Good Tuesday morning, everyone. Welcome back to Atlanta & Company. I'm Christine Pilara. From self-help books to movies, we're told that you should listen to your heart. Now, I know that message generally isn't meant to be taken literally, but in a very real sense, you should pay attention to your heart, because when it comes to heart disease and your risk factors, you need to listen to what your heart is telling you. Here today to tell us how to do just that is cardiothoracic surgeon, Dr. Alex Justicz. Welcome to the show.
Thank you very much.
Thank you for being here. I think of all the iconic things of, back in the day, Sanford & Son, he would grab at his heart and say, this is it, and that was kind of a funny thing that, okay, he was feeling some pain. This is it. It was his time to go. But truly, you hear people all the time of having heart attacks, having problems, and them not experiencing any symptoms. So what are the indicators? What should we be paying attention to?
Well, I think the most common thing by far, as you mentioned, is the classic crushing chest pain.
Okay.
And right behind that would be a degree of shortness of breath, or even a sensation of palpitations in the heart and irregular heart rate.
Right.
But also, very importantly, about 25 or 30% of people will have what we call a silent heart attack. And that can be
scary.
Muscle damage to the heart that they are unaware of.
Okay, well, let's break down the symptoms then. When should we call our doctor, and when should we call 911?
Well, I think if you feel that the situation is very stable and subtle and has been going on for a while, then that would be a reason to call your doctor and perhaps schedule further evaluation. However, if you have any of the more classical worrisome signs that we just mentioned, the chest pain, perhaps a sudden onset of shortness of breath, an irregular heart rate.
And you haven't been exercising, right?
Right, sure. Or sudden onset of nausea, cold sweat. Those are the kinds of things that I think if you really have a high index of suspicion and you're really worried, go ahead and call 911, because we tell folks that time is really crucial in this situation.
I've always heard that. And the holidays are right around the corner. We're going to be spending lots of quality time with the family, and that's actually a good thing, because we often need to sit down with our family members and learn more about their health so we can know what we're going to be at risk for.
Right.
And it's so many times, we have to fill out those questionnaires when we go to the doctor. Tell me about what has run in your family and how that has an impact on us. So we need to know what has gone on with our mothers, our fathers, and our grandparents, right?
Absolutely. There are the things that you can change, and there are the things that you cannot change.
Right.
And certainly your heredity, what experiences your parents have had with their own cardiac conditions, whether or not they have high cholesterol, high blood pressure, history of any interventions on their heart. Those sorts of things are very important to find out. Okay,
terrific. So we have to be armed with as much knowledge as possible. And of course, as we plan for the new year, should we be screened for heart disease? Is this something that's a special appointment? Can it be done with our family practitioner? When do we do this?
Well, certainly a majority of this can be done with your family doctor. But if there are subtleties, or if your family doctor doesn't have any comfort with that, then certainly a cardiologist would be the next logical step.
Okay, but most of us, we might have to see the family practitioner first to get the cardiologist's referral.
That may be the case.
Right,
yes.
Yeah, that's often the case. And I know that there are different symptoms with men and women. Talk about that, because that surprised me when I first heard that.
Well, women in general have a higher incidence of having a heart attack that is silent, that they won't be aware of. And that's not totally understood, but one of the reasons is that women tend to have their heart attacks after menopause, when they no longer have the protective effects of estrogen.
Oh, really?
Yes.
And that's so scary. So that is the case where we'd have to make sure we're getting screened every year to see what's going on. And what are the general causes of that? Right.
Well, the general cause is that the artery to the heart supplies blood to the pumping chambers and to the muscle.
Okay.
And when the artery gets a blockage in it, that leads to the symptoms of a heart attack and can cause muscle damage. And if it's not a classical heart attack with the chest pain, that can be nausea, sweating, a sensation of heaviness in the chest, or just generalized anxiety.
Was there numbing that I thought I read once?
Numbness is also a symptom. Heaviness in the chest, back pain, arm pain, jaw pain, pain into the neck.
But that's so scary, because that could mean so many different things. So you just have to, again, as we said in the introduction, listen to your heart, listen to your body, and just don't brush symptoms aside. And then for men, primarily?
For men, the classical indication is crushing chest pain. But that doesn't have to be the chest, as we said. That can be anywhere from the jaw through the neck into the arms and into the back.
Okay.
And then in certain circumstances, the main indication of a problem can be an onset of nausea or even vomiting.
Right.
And if somebody is having a silent heart attack, there can be a sense of doom or even cold sweats.
Right. And doctor, I know we say it week after week, especially during our WellStar weight loss competition we're having right now. Eat right and exercise, that's going to make you healthy. But the truth is, it does. When we're eating right and we're taking care of ourselves, it reduces heart disease significantly, would you say?
Right. Well, you know, there are things that you can't change, like the family heredity. And then the things that you can change are your activity level, your exposure to stress, the things that you eat. Right. All of those things can have a dramatic impact. If you lose a little weight, that can have a dramatic reduction in your cholesterol.
Right.
And of course, that cholesterol leads to the plaques that form in coronary arteries that can cause these blockages.
Right. It's important that we take inventory on what we're doing, and the new year is the perfect time to start making those positive changes. So thank you so much, Dr. Justicz. Appreciate your time.
Thank you very much.
And of course, for more help and insight into changing your own heart health, we would like for you to learn more by visiting 11alive.com/takethepledge to learn more. And to take the pledge to getting a healthier heart, you'll receive a free pedometer and be entered into a monthly drawing for an iPad Nano. And we have a big announcement. This month's winner is Kim Boehm from Sandy Springs. Congratulations, Kim. And thank you for listening to your heart. And thank you for tuning in week after week. We appreciate it. And this segment was paid for by Gwinnett Medical Center.